My name's Jordan Trimble. This is my head-to-toe assessment for health assessment. Would you please state your name and your age for me?
Jesse Rios, 25.
Okay, and can you tell me how tall you are and how much you weigh?
5'9", 195 pounds.
Awesome. I'm going to take your blood pressure. Do you currently take any medications at home?
No, ma'am.
Do you have any medical conditions?
No, ma'am.
Any allergies to medications?
None.
Over 80. Next I'm going to check your pulse by listening for 30 seconds, at the same time watching your respiratory rate for 30 seconds, and I'll multiply by 2. So heart rate of 60 and respiratory rate of 14. Okay, the next thing I'm going to do is look at your skin, starting with your hands and nails. I'm assessing for moisture, for color, which is normal for your ethnicity. There's no clubbing or edema noticed in your fingers or extremities. Your capillary refill looks good, less than 2 bilaterally. Are going to also see about tenting, which would indicate dehydration to me, which is not present. The next thing I'm going to look for is any pigmentation problems, any lesions of any sort. So the only thing I see is on this hand. Do you know what happened there?
Yeah, burned.
Okay. No other lesions or anything that you've noticed over your skin?
No.
No skin concerns?
No, ma'am.
Okay. All right, I'm going to assess your scalp for lesions, bumps, or pain. Let me know if anything hurts during the exam. All right, hair is evenly distributed. We are also going to check your facial nerves, cranial nerve 7. So I need you to smile really big for me. Really big.
That's as big as it gets.
And puff out your cheeks. Good. Okay, and smile again. All right, so there's facial symmetry. Eyelids look normal, no ptosis, lid lag, discharge or crusting, irritation of your eyes at all. Okay, I'm going to check your pupils. Okay, do you wear glasses or contacts?
No, ma'am.
Okay. We're going to check your visual fields, so I need you to cover your left eye with your hand. And when you can see my finger come into your field of vision, I need you to let me know. Okay?
That's it. That's it. That's it.
Okay, and same with the other side.
That's it. That's it. That's it.
Okay. So, visual fields are full by confirmation. We're going to do your extraocular muscles. I need you to follow my finger, and we're going to also do more visual fields. Okay, follow my finger. Okay. Okay. Extraocular muscles are intact. No nystagmus or strabismus. We're going going to do corneal light reflex also and check for symmetry and make sure that the light reflects evenly on both sides. All right. I'm going to assess your ears. Have you had any drainage or pain with your ears? Any ringing in your ears or loss of hearing?
No.
Okay. Any lesions or anything that you've noticed?
No.
You feel they're symmetrical. No drainage or anything noted. What about your nose? Do you have any history of nosebleeds? Ever broken your nose before?
Yes.
Yes. Do you have chronic nosebleeds?
No.
No. Okay. Any pain?
No.
Okay. So I need you to, we're going to test patency of your nostrils. I need you to plug your left nostril with your finger and inhale for me. Same on the other side. All right. Both nostrils are patent. All right. I'm going to assess your mouth, your lips and your buccal mucosa, as well as your tongue and your gums. So if you could open up for me. Open your mouth. Thank you. Everything is pink, moist, and intact, no lesions. I'm going to ask you some questions about your dental visits. When's the last time you've been to the dentist?
8 months.
8 months ago. Okay. How many times do you brush your teeth per day?
Twice.
Twice. Do you floss daily?
No.
Okay. So you should visit the dentist again. It should be every 6 months. And we should be flossing every day, at least once a day. I don't see any discoloration, presence of caries in your mouth. Color and everything is appropriate. I would check for your gag reflex now, but I don't have a tongue depressor. So we would do that by placing it the back of the tongue and press down. Can you just open up one more time for me so I can look and make sure your uvula is symmetrical? Yeah, good. Okay. Next is going to be your neck. I'm going to palpate your carotid pulses. Okay. Present. Present and 2 plus bilaterally. Your trachea is midline, no shift. We're going to test range of motion. So if you could tilt your head to the right for me, and to the left, and backwards, and down all the way. Okay, we're going to do that against resistance. I'm going to test your muscular strength. Can you push against my hand? Good. Push against my hand. Okay. And push. All right. And push. Awesome. Okay. So strength is normal. Range of motion is normal. Okay. Can you shrug please against me? Good. Okay. So cranial nerve 11 is intact. I'm going to assess your posterior chest and lungs. If you could turn around in the chair for me. Thank you. I'm going to shift it a little bit. Okay. All right. Okay, so I'm going to assess the thoracic cage and look at configuration, shape, and symmetry upon expansion. Can you breathe in for me? Good. Another deep breath. Awesome. And another deep breath. Awesome. Okay, so there's symmetric expansion. There's no barrel chest. No use of accessory muscles. I am going to feel for tactile fremitus. I need you to just, when you feel my hands move or touch you, say 99. Okay, so 99.
99.
99.
99.
Okay, awesome. Okay, and I'm going to feel for costovertebral angle tenderness. So I'm going to feel right up here underneath your kidneys. Let me know if you have any tenderness, okay? Any tenderness?
No.
Okay. I also don't see any lumps, lesions, or discolorations to the skin back here. Next thing I'm going to do is listen to posterior breath sounds. You can take a deep breath for me. And one more. Okay. Lung sounds are vesicular and clear throughout all fields. You can turn back around for me. We are going to do the anterior chest. Okay, so we're going to also do again the tactile affirmative, so I'm going to do the hands, and I need you to say 99. Okay?
99.
All right. Thank you. I'm going to listen to your breath sounds. Anterior breath sounds are vesicular and normal, clear in all fields. I'm going to listen to your apical pulse. All right. And first I'm going to palpate for it. Apical pulse is palpable. I'm going to listen for rate and rhythm. Apical rate is 64. Okay. I'm going to listen to heart sounds, listening for S1 and S2 or any murmurs. S1 and S2 are present, no murmurs. Next is going to be upper extremities. So if you could put your hands out in front of me like this, please. We are going to push against me. Good. Okay, so I want you to bend your fingers forward towards me. Thank you. Okay, and your palms up towards me. Good. Okay. So range of motion is intact, and you're strong bilaterally. I'm going to feel for radial and brachial pulses on both sides. Radial pulses are 2+ bilaterally. Brachial pulses are 2+ bilaterally. Okay, so I'm going to have you lay down. We're going to lay down on the table. On the end if you want, or whatever. Thank you. Okay, I am checking for the presence of any jugular vein distension, which I do not see is present. I'm looking at the abdomen, contour symmetry of the umbilicus. No pulsations are present. Umbilicus is inverted. I am going to listen to bowel sounds in all 4 quadrants. Listening for normal, hypo, or hyperactive bowel sounds. Bowel sounds are present and normal, active in all quadrants. Okay, I'm going to palpate now lightly and then deeply. Let me know if you have any pain or discomfort. Okay, didn't feel any lumps, any pain with that?
No, ma'am.
Okay, a little deeper. Alright, no lumps, any pain with that?
No, ma'am.
Okay, we're going to percuss all 4 quadrants as well. is heard in all 4 quadrants. Okay, I'm going to look at lower extremities. For symmetry, I'm looking for skin characteristics, hair distribution, no lesions, no scarring, no pain in your legs, sir?
No, ma'am.
No. Okay. So legs are symmetrical. They're normal in color. Hair is evenly distributed. I'm looking at toes. Capillary refill is less than 2 bilaterally, which is good. I don't see any clubbing. Temperature is warm to the touch. I don't find any edema either. I'm going to check pulses now, starting with femoral. All right, femoral are intact, 2+ bilaterally. Check popliteal pulses behind the knee, 2+ bilaterally. I'm doing posterior tibial now. Which are 2+ bilaterally, and then dorsalis pedis. Which are 2+ bilaterally. Okay, we're gonna assess hip range of motion. If you could bring this leg all the way up to 90 degrees for me. As far as you can, okay, and bend the knee to 90 degrees, and back, good. Okay, we're gonna do the same on the other side. You could bring your leg up, bend, back. Okay, any pain with that?
No, ma'am.
Okay, any pain in your back with that?
No, ma'am.
Okay, I'm also gonna assess for any crepitation or unsteadiness in the hips. The hips seem stable, no crepitus. Any pain?
No, ma'am.
Okay, if you could bend your right knee up and place your foot on the table. Okay, we are going to assess internal rotation and external rotation. All right, and back out, and other side. Okay, internal rotation, external rotation. Okay, it's appropriate. Any pain?
No, ma'am.
Okay, ankles and feet. I don't see any swelling, any pain in your ankles or feet. No tenderness, ulcers, redness or edema. All right, we're gonna lift our feet. Can you point your toes towards your head? Okay, and point your toes towards me. And now do it against me. Good. And against. Good. And move your ankles in a circle. Perfect. Okay, so range of motion and strength is equal bilaterally. You can sit back up. Okay, if you want to sit on the edge of the table, that's fine. We are going to do a sensation. So if you would shut your eyes for me, I have a golf tee and a paper towel since I don't have my normal tools for soft and sharp. So when I touch you with either one, I want you to let me know if the sensation is sharp or dull, and where you feel me. Okay? All right. So we're going to start on the face.
Cheek, sharp.
Okay?
Left cheek, soft. Right bicep, sharp. Left bicep, soft. Right forearm, sharp. Left forearm, sharp.
We're going to do the legs also.
Right quad, sharp. Right foot, soft. Left quad, soft. Left foot, soft.
Awesome. Okay, you can open your eyes. We're going to stand up. I'll help you down if you need it. Okay, and I need you to, let's do this way. Okay, stand in front of me and face the wall. I'm going to have you bend down and touch your toes as best you can. You can bend your knees if you need to. I am assessing range of motion, which seems normal. I'm assessing your spine, which has good range of motion as well. Any pain?
No, ma'am.
Okay, stand straight back up for me. Awesome. And if you could shallowly bend your knees so I can just assess your balance. Good. And back up. Okay. All right. If you could for me also, we're just going to walk forward, heel to toe. Okay. Just walk normally for me. Just assessing your gait and your balance and your stride. Any pain in walking?
No, ma'am.
Okay. All right. So the next thing we're going to do is walk across the room on your tiptoes and walk back to me on your heels.
Yes, ma'am.
Okay. Okay. That's good. All right. You want to have a seat? Okay. So everything looked pretty good today. And just follow up with your dentist. You can go see the dentist every 6 months. Make sure you floss. Do you have any questions?
No, ma'am.
Okay. All right. Well, thank you. That's all.
Yes, ma'am.
Thank you.